Hi, my name is Sandy Kerrigan, and I'm a CNA at an elder care facility in Connecticut. I'm not going to mention where I work, and I'm not going to mention any names. If I do actually have to mention a name, it's going to be fictional. I am a CNA, and that means that I assist nurses in their job. And for elder care, that means that I actually do more assistance with the resident than with the nurse. Basically, what I do is I do everything that you do for yourself. I help people take showers, wash their body, wash their face, brush their teeth, go to the bathroom, physically get up out of bed, roll over. I clean up people who are incontinent or unable to make it to the bathroom in time. I tie shoes. I pick things up off the floor. Basically, I really do just what you do on a daily basis. I do for people who can't do it for themselves, and my main focus is elder care. CNAs can also work with the disabled or home health. There are many fields, but for these purposes, I do an elder care facility that also does some rehab. I also deal with I keep looking down at my hands. I also deal with 2 diseases. There are more, but my main concerns happen to be MRSA and C. diff. MRSA stands for methicillin resistant Staphylococcus aureus, and C. diff is Clostridium difficile. And if you want more information than what I'm providing, you can look it up on the CDC. I had to, just because I always forget what MRSA stands for. MRSA, it is a resistant disease. It does not like antibiotics, like penicillin, amoxicillin, things you would usually use. MRSA is not going to care. It's going to stick around. It's usually in wounds, blood mostly. You see it a lot with like pus, which is fun. But I need to be aware when someone has a MRSA outbreak. And I say a MRSA outbreak because it's always present in the body once you get it. But it's kind of like herpes. You always have it, but it's not always there. So I have to be aware when someone has a MRSA outbreak. That usually means that they have a bandage. And the way that I manage that is that I go into rooms and I protect myself using gloves, because that's really all you need when it comes to MRSA. And I bring in bleach wipes and I wipe down all hard surfaces because it will survive on that. And I'm not just protecting myself, but I'm also protecting the resident from infecting a different area of their body. Say they have a open sore on their leg, they can scratch that and then go and scratch their arm. And if they were to actually scratch themselves open, they could then put it in their arm. And I mean, it's one thing or another. Once it's in your blood, and arm blood and leg blood are the same. But we're trying to eliminate that. Plus, there's also the possibility they can scratch their leg, they can touch their side table, and then they can go and accidentally scratch a friend. So now they have it. It's on their side table, so anyone that touches their side table has it, and then they can also pass it to their friend. So I go into those rooms with bleach wipes. I wipe down all hard surfaces, and I do that a couple of times by shift. And I work 3rd shift, so really I only do it about 3 times. But throughout the day, I know they do it about 4 or 5 times. The other one that I mentioned, Clostridium difficile, is when elderly. It seems to affect the elderly more than most. They're on so many antibiotics that those antibiotics are actually killing their natural flora that's in their intestines and allowing the endospores that are in their intestines to take over. Endospores are resistant to pretty much everything, so it's really hard to cure someone of C. diff. All you're really doing is trying to help them move forward, eliminate it. And one way that I did learn it was a possibility is they actually do what's called a fecal transplant, and they take healthy fecal matter from from one person, usually a relative, a close blood relative, and they'll put it into the other person. And I'm not really sure exactly how it's done, and I know it's not really a widespread thing, but I do know that it does happen. And they also have pills that have fecal matter in them. That's another way that it can introduce new flora into your intestinal system. C. diff is treated slightly differently. You still go in there with gloves, and you still want to bleach wipe everything down, just in case the resident has dementia and they do touch their bottom and scratch at their bottom, and then they touch other things, because C. diff will live a long time on hard surfaces especially. I also wear a gown when I'm going in those rooms, just to make sure that I'm not getting anything on my clothes, and therefore it's not living on my clothes, and then I'm bringing it to another patient. Another point to my job, aside from dealing with two very resistant and virulent diseases, is that I help maintain dignity for my people. I help them by calling them by their preferred name. Some people like Robert Ryan Lynn. He likes to be called Ryan. Now that's his middle name, and that's what's on his sheet as his middle name, but that's his preferred name. He doesn't want to be called Bob, he doesn't want to be called Robert, and he doesn't want to be called Mr. Lynn. He wants to be called Ryan. So that's what you do. You want to make sure that you know that information before going into a room. And one more thing that people tend to not understand is that you can walk out. If someone's being overly abusive to you, if they're hitting you a lot, or if they're just being rude in a very violent verbal manner, you have the right to walk out of that room. You don't have to deal with that. Being a CNA, it's not really for everyone. My job is very difficult. I deal with a lot of different emotions. People are dealing with different things in their life. They're brand new. Their family put them in this place, or they don't see their family very often, or they have Alzheimer's, which means they're dealing with puberty. That starts eating away at your brain, and you go in reverse. So I'm dealing with a lot of different things, and being a CNA, it's not really for everyone. But the people that do it, they're just amazing. You have to know, and you have to know that you're going to be helping someone through what everyone takes for granted. You're going to be helping someone relearn how to brush their own teeth. And I feel that that's really important, and I really love my job, but I really know that I don't want to be doing it, and that's why I'm trying to become a nurse. Outside of that, there's really not much to it. Maintain privacy and respect.